The anxiety and stress of these times are a lot for any of us to handle, so where and how to turn for help? Susan Spencer has an answer.
Teresa Brown has had a life without luxuries or much security or any peace of mind.
Talk to me a little bit about this feeling of stress that has basically been with you since you were a child.
In order for me to kind of talk about it, I have to think about the traumas that I've been through. Traumas like not just growing up poor, but growing up where we lived in apartments that didn't have heat, or grew up in neighborhoods that had high crime, or went to schools where you were bullied, those things.
She spent years trying to process those traumas, all the while raising her 3 nieces in New York City. Finally, she found help from a therapist.
What kind of things do you talk to the therapist about?
Pretty much what is it I could do to either relieve my stress or find tools to help me deal with the situations that I have been going through.
But 3 weeks ago, she wasn't sure she'd ever see that therapist again.
New York State has become the epicenter of the outbreak. 6% of all cases in the world are there.
The pandemic meant that Mosaic, the not-for-profit mental health center in the Bronx where Teresa goes, had no choice but to close its doors to in-person visits. No one-on-one therapy, no counseling.
When you realized the magnitude of this pandemic, was there a time when you weren't sure that you'd be able to continue to serve your clients?
Yes, and that frightened me tremendously.
Donna Dimitri Friedman is the executive director of Mosaic, off limits to visitors in these strange times, so we filmed her working outside. She says she could not imagine leaving more than 1,000 desperate low-income clients with nowhere to turn in the midst of a terrifying pandemic.
The stakes are very high. Some people have anxiety, some people have major depressive illness, and that's all heightened, of course, in this crisis. So we would be seeing people really begin to decompensate.
So 3 weeks ago, Friedman's staff of 100 took drastic measures.
Hi, this is Katie from Mosaic calling.
Switching all mental health counseling to teletherapy, a fancy name for using the phone. They weren't authorized to do so until the pandemic hit, and New York State waived its regulations.
It seems like this must have been a sea change for you.
So we mobilized immediately, actually before we even had guidance.
What about the challenges in terms of actually helping anybody this way?
So there was some resistance from the clients and some resistance from the staff. How are we going to do this? Is this really going to work? But pretty quickly, people kind of have pulled together and are doing this and doing their part and responding.
For what we're dealing with now, is teletherapy pretty much the ideal tool?
Teletherapy is ideally suited to providing mental health care under the current circumstances, and it's being used more now than ever in history.
And it's a long history, says Dr. Jeffrey Lieberman, chair of the psychiatry department at Columbia University College of Physicians and Surgeons. Back in 1959, the Nebraska Psychiatric Institute first used video conferencing. A decade later, teletherapy consultations were available to troubled travelers at Boston's Logan Airport. And about 30 years ago, telepsychiatry became a subject of serious study.
Do you think that really it's as effective as it is to have a one-on-one conversation?
Well, there's actually substantial data from systematic studies which show that it is effective.
It better be, now more than ever. New research shows that living in quarantine can have grave, long-term mental health effects, as New York Governor Andrew Cuomo recently recognized.
I'm asking psychiatrists, psychologists, therapists who are willing to volunteer their time to contact the state.
More than 6,000 people responded. No surprise to Dr. Lieberman.
This is going to have a population-wide effect of PTSD proportions. It's almost primal. It's almost apocalyptic in its nature.
What are the challenges that the whole teletherapy thing poses in itself?
What is lacking is the ability to see someone's face, to, feel what someone brings into a room. But I don't know where we'd be without it right now, frankly.
What do you mean?
I don't know where we'd be without that connection right now.
Katie Reardon is a mental health counselor at Mosaic. Lately, she's been on the phone a lot, offering therapy 6 days a week, about 10 hours a day.
So what have these weeks been like for you?
It's been exhausting. It's a strain.
One of Katie's clients is Teresa Brown, whom she knows as Terry.
Terry is the guardian of a family and balancing so many different challenges, financial, educational, physical space. This pandemic didn't get rid of problems that existed prior to it coming along, right? So all these stressors that have led people to feelings of helplessness and hopelessness and anxiety and powerlessness before this emerged, now they're just compounded with the world as we knew it, being shaken up.
That's your challenge, isn't it?
It's Terry Brown's challenge. It's my challenge.
Yes, I have a lot of anxiety, but I am trying so hard to be positive about this because it's not just for me. It's for my children, and I want them to understand that don't panic. Things will get better.
For now, at least, that may be the best advice of all.